Bonjour à toutes et à tous.
Hello, everyone, and welcome to this press conference for the resumption of sports activities and leisure activities. Ms. Charest, the Delegate Minister for Education, is going to give a speech, and Dr. Massé is going to be there to answer the question. We'll go to the question period right after Madame Charest speaks. Madame Charest, the mic is yours. So, hello, Dr. Massé, and hello, everyone. Of course, I am extremely happy to be with you today in order to announce to you the return of sports activities as well as organized recreative activities. It will be a progressive resumption, of course, but today I want to announce to our children, our young people, they are finally going to be able to find their team members again, and that is excellent news. The situation is still delicate, and we still have to continue being very careful. But now that vaccination is on its way, we are more and more optimistic that we will, over the next few months, be able to find a more normal life. We therefore today propose a first series of important lightning that will make many people happy. I'm convinced of it. You know that I chose to jump into politics in order to make it that the public, and young people in particular, would be more active. No need to tell you that I have experienced very disappointing moments in the past few months, but after very difficult weeks, I'm happy to be here in front of you today to finally be able to give some good news. Therefore, I'm announcing the beginning of the return of sports and recreative activities that are organized as of the 26th of March. Today's announcement is the result of teamwork, that of the Ministry, together with Public Health, as well as the Sports and Leisure area. Since the beginning of the pandemic, organizations and federations have made health plans. Sports Quebec, the Réseau de Sport Étudiant, and the Quebec Association of Municipal Leisure have also helped us quite a bit. And I'm convinced that Dr. Massé has felt that mobilization, and I believe that if we are here today, it is in great part thanks to the proactivity of the sports and leisure people, and perhaps also because I'm very stubborn. I would like, however, for us to remember that we have to go progressively. It is only by going slowly that we'll be able to do those activities that make us so happy. I am confident that we'll be able to take advantage of a very pleasant summer. Of course, health guidelines will still be present. However, we should be able to practice many of our favorite activities, even though it means doing it slightly differently. So let's start by the red zone. Outside activities without contact are still allowed for a maximum of 8 people. We can have a coach or a trainer who supervises activities, but the good news is that gyms and inside sports complex will now be open in red zones, and that also includes physical gyms. Activities will have to be practiced individually or 2 people or people who live together, of course, depending on the capacity. It will be restrained. In orange zones now, groups of maximum 8 people will be able to have activities inside, but with a mandatory framework by somebody responsible for respecting and making those measures be respected. In every case, we'll continue to not allow spectators in all situations as well as competitions. Groups of 12 people will be able to do outside activities, of course, still while respecting the distancing measures. As far as sports and leisure in primary and secondary schools are concerned, we had already announced last week that extracurricular activities that take place inside of a classroom bubble could start as of next Monday, that is the 15th of March. In red zones, it will remain like that for a few weeks. Of course, physical education and health, as well as specific physical activities, are still authorized in stable class groups only. In orange zones, however, as of the 26th of March, extracurricular activities intra-school will be back. Not 100%, but it is back to more normality. A maximum of 12 students coming from different classes will be able to practice outside activities without any contact. Inside, the maximum number will be of 8 people. It is therefore exactly the same rule that will be applied for the public in general. So 12 outside, 8 inside. Same thing as far as sports and leisure activities in CEGEPs and universities are concerned. So the rules will depend on the level that the establishment is situated in, red, orange, etc. But regardless of the zone, the training in leisure and sports in the programs offered by those educative establishments is maintained. In all cases, the practice of activities has to be adapted to respect physical distancing of 2 meters. Last point, the people who need to be accompanied, for example, people who have a handicap or people less than 10 years of age, can be accompanied to practice an activity. So that is essentially what our recommendations are. I would like to repeat that these new guidelines will start being in effect as of the 26th of March. As I was saying, this is a first phase of ending the lockdown, and it is only a beginning. Other steps will follow if everything goes well. Today's announcement is a return to play for organized sports, but what is most important is that our young people will finally be able to find their team mates again. I would like to remind you the following weeks are going to be determining. It is time to go back to training to, possibly having games again. So I would encourage you all to pursue with your efforts in the coming months to respect the guidelines, because we're almost there. And as the Premier often repeats, it would be really unfortunate to stop being careful in the last bit. I would like to end by saying thank you to the entire public for your patience. I understand that it's been difficult, and I understand that really the past few months have been so difficult. We've asked you for a lot, but I 100% trust that you can respect these guidelines and that things will therefore go well. Thank you as well to all the partners of the sports and leisure groups for your collaboration, for your proactivity, as you always are. I'm so proud to be able to count on you, and I really trust that we will see one another very soon for more good news. So, courage, let's remain prudent, and see you soon. Thank you very much. We will now start with the French questions.
On va commencer avec le micro numéro 1.
Microphone number 1.
Je vous demanderai de, évidemment, vous nommer votre média. On va s'en tenir à une question et une sous-question par journaliste, si possible, sur le sujet du jour. Donc, micro 1.
Bonjour, Mme Charest, Annie Guillemette, au 98.5. Est-ce que je comprends bien qu'en zone rouge...
So am I to understand that in red zones, what is being added right now are external outside sports like we had around Christmas time, around the holiday time? No, you didn't understand well. What we're adding in the red zones are the inside infrastructures. So because we know that in the past few weeks, we could use the skating rinks and the pools. But now all infrastructures, generally speaking, will be opened. So, a dance studio can be open, but of course, the practice has to be done individually or as a dyad, so 2 people, or for a bubble of people who live in the same residence. So I imagine that I perhaps represent the average people. All of that is complicated. Red, orange, inside, outside, schools, organized sports. How are we going to make sure that people understand, and particularly so that those measures are applied? Well, there's no distinction between school sports or city sports or leisure at school or outside. It's the same rules for everyone. So I think that already we are improving the possibility to understand. There is a distinction between red and orange, just as is the case for every measure. So it's pretty simple. In red zones, the outside infrastructures, 8 people plus 1 person doing like a coach. Inside, it's individual practice, or as a dyad, or with somebody that you live with. In orange zones, it is 12 people outside, 8 people inside, who can come from different households. However, for each of those activities, physical distancing of 2 meters is still required. No contacts, no competitions, no spectators. Health guidelines are still in place, and there is somebody who is responsible who makes sure that all these rules are going to be applied.
va y aller au micro 2.
Oui, bonjour Vincent Maison.
Microphone number 2. Yes. If you could explain to me concretely, somebody who's part of a hockey team, how is it going to work?
Entraînement individuel, là, mais en zone orange, par exemple.
But in orange zones, how is that going to work? In hockey, teams, often there's more than 8 people. In gymnastics, the same thing. Well, it's going to have to be groups of 8 people, so separating the team in 2 to train them. In gymnastics as well. It'll be a group of 8 people in gymnastics as well who will be able to train. So there's an adaptation, as I was saying, but I still think that it's pretty good in the sense that every group has to be of 8 people. And the 2-meter distance has to be respected, and there's one person who is responsible for having the rules applied before, after, during the cleaning of the infrastructure. So I think that it's pretty relatively simple, the way that it's applied. And you said that you've re-evaluated that you will re-evaluate it. How often, and what are you going to base yourself on? Well, we have a progressive plan that is going to take into account the epidemiology in Quebec in general. That's why there are changes of zones, between orange and red, for example. And also we have to take into account the presence of the variant, which is not everywhere the same, but also the rate of vaccinations that we'll have in the public. So since the public is going to be more and more vaccinated, we'll be able to progressively increase. So in the next few weeks, and the delay is still to be established, but a few weeks after, we'll certainly be able to broaden things, and things that are allowed right now in orange zones are going to be allowed in red zones. It's going to be like a step-by-step, like a staircase. It's going to be done week after week, but of course we do have to take into account the epidemiological situation. If we follow things in time, we'll see that by June we should have most of the Quebec public that will be vaccinated, not young people because we can't use the vaccines yet, but that means that it will allow us to be a lot more permissive, and then probably have most of our activities done, but with modifications. So adapt, using this new reality into account. However, we'll be able to have a progressive deconfinement over the next few weeks, as was mentioning Ms. Charest. I see no questions in the room for the journalists who are present physically, so we'll now go to Zoom questions.
Ouvrir juste votre micro quand je vous nomme. On va commencer avec Geneviève Lajoie du Journal de Québec.
Entendez-vous bien?
Là, oui.
Can you hear me?
Écoutez, est-ce que là, on comprend que c'est le...
So now we understand that it is the return of training in orange zones, in smaller groups. Could you still predict to us or give us a bit of an idea of the possibility of the return of games? Because young people love, of course, training, but they particularly love playing. Well, I think that Dr. Massé has answered the evolution of the plan that we have right now. Of course, the objective is to go as quickly as possible and to be able to go back to the games and also to be able to train in a more complete way for combat sports, for example. Of course, we're going to see the evolution of the following weeks. We're going to see how vaccination goes and all that. And maybe Dr. Massé, did you want to complete? Well, I think that already the fact that people can start now with training in orange zones in small groups, which is a relatively normal format. It's not unusual to do that. Even professional players start, training in smaller groups and go progressively. So we're going to get back to games and sports as people know it, but once again, with certainly modifications that are going to be ready over the next few months. So once again, we don't have a closed agenda at this stage, but we can see that within 2 or 3 months, we should be a lot further in the return to life. We'll call it more normal life or quasi-normal for sports. I think that Dr. Massé has a really important point. I think that that we have to remind ourselves of today is that young people can go back to, getting fit again to be ready when the season will be launched more normally, if you will. But the fact of being able to train as a group, of course, is going to make it that we will be able to increase the motivation of many people, and that also does not prevent getting challenges. Of course, I was an athlete in the past, and we've done a lot of training over the ice. So I've done a lot of, training at Parc Maisonneuve, where we trained all summer doing all other kinds of training. But of course, that kind of training makes it that we are ready for the season and we evolve and go forward. So it's not because matches are not yet allowed that it's not worth, getting fit and going back to training. So I encourage sports organizations and coaches and the leisure world, of course, also to have a resumption that is adapted in a different way, of course, but then you can also develop new ways of doing things that are certainly going to be useful and make it that you will be a better athlete after. My following question is perhaps more for Dr. Massé. The pressure is very strong and has been very strong in the past few weeks to go back to sports activities. We have even felt that the government wished to go faster, but we had the impression that Ms. Charest was always stuck with the decision of public health. At least that's the way she expressed it. What prevented you from giving the green light to what you're allowing today? We had an increase, a second wave, that was relatively significant. Although, from the point of view of the impact on the deaths and hospitalizations, it was not as damaging, if you will, but it's still very damaging, but maybe, a lesser amplitude than what we had last week. That being said, we had the appearance of variants in Quebec, and what we saw in Europe, what we can see in Europe, is that the level of transmission is more significant with the new variants that have appeared and are present here, and that has made us prudent. Although we can see that the rates have decreased as of January, now I have to say that bravo, Quebecers have behaved, that we can qualify as being relatively exemplary. In most cases, people have respected the guidelines, and that has really allowed to lower the transmission. However, that situation for us had to be stable and had to be there for many weeks, because what we didn't want was to go into a third wave before we could really stabilize things, because many weeks of stabilization are required, and we wanted to give oxygen a little bit, breathing room with the spring break, and that was important for us to see the impact of the spring break, and we'll see in the following weeks as well how things will happen. We want to go very progressively, you'll understand. So, yes, we had a lot of pressure and a lot of requests on the part of Ms. Charest, but not only Ms. Charest to say, and we understand, because there are issues of mental health, there are issues of mobilization, there's people end up, dropping out as well to a certain extent, but we have to balance things out as well, saying, yes, there's those issues of mental health and of, people need to go back to their activities, and that is essential. We've been very conscious of that, but also we have the entire protection of the most vulnerable people who are not yet very vaccinated. We have the elderly who are vaccinated, but the other ones haven't been yet. So it's that fragile balance that we have to deal with. And the way to deal with it is to go with micro adjustments, So some people would want them to be more important, but that balance is kind of difficult, and everybody in public health throughout the world, they have to lead to, deal with this. So that is what we're doing right now, trying to create that balance. And that's normal, and I think that people understand that we are prudent and that we want to not take any chances with those most vulnerable. But at the same time, we have to balance things out. We really have to see it as, risk management. When you take into account the entire population and not just some people who feel that they have needs and that they're not at risk of the disease, we have to take everybody into account.
Madame Charest et peut-être Monsieur Massé pour
Ms. Charest, you are saying that you are allowing sports progressively, gradually. You've been very evasive on a possible resumption of games this summer or for the next few months, but how long, in how much time will you be back, so that we know whether we can, allow more things, for example, games in red zones and things like that? Well, that question is always hypothetical, to know how the next few weeks or the next few days or few weeks are going to evolve. Of course, it always depends on the evolution, so we can't give any dates. However, we do trust, and that is what I was saying, that with the evolution of the vaccination process, and we better understand the variants and all that, and Dr. Massé would be able to express himself more on that. We trust that it will be able to evolve. Deconfinement of sports will be able to evolve quickly. But first, I think that what, for me and for the entire sector of leisure and sports, what is important was to be able to make sure that we were going to have a general reopening, so that we weren't going to make any distinction between the different sports disciplines. And I think that that was really important, because judo can start, respecting the distancing rules. So, of course, there's no contact in the training, but a judo club can very well train, 8 people, and do so while respecting the health guidelines. So for us, it was important to make it that everybody was going to be able to adapt their sports practice depending on what their own sport is, but to not open, one discipline, one after the other, and to limit one sport that could very well adapt itself. So I think that today's news is easy to apply because it concerns everybody, all installations, all facilities, of course, with a varying degree, depending on the zone in which people are. But I think that this is really a step in the right direction. So thank you to Public Health, who I believe have heard the message that we really first wanted to trust the different environments, because I think that people can take the responsibility of organizing their sports activities in a safe way. So that is a huge trust that we are showing. Of course, those who are responsible have a lot of responsibility on their shoulders right now, but I totally trust that it will be done in a safe way, and that it will make it that we can, as quickly as possible, evolve with the deconfinement, and as quickly as possible get to matches or, of course, competitions or more significant lightening of the guidelines. So I'm very optimistic. Have I understood? So gyms will be able to open, are going to be able to open even in red zones, and outside it's 8 people. So, for example, hockey outside, hockey. The interpreter didn't understand very well. The sound wasn't very good. Yes, so the gyms can open in red zones. So training can be done individually or as a dyad or in a household bubble. Outside hockey, training can, yes, be done, but not games. So yes, that's it's possible to be able to do this, while respecting the physical distancing.
Bonjour à tous les deux.
Hello. Madam Minister, I just wanted to make sure that I've understood properly as far as high-level sports is considered, for example, pee-wee hockey, bantam, etc. Are there things that are going to be done specifically for those young people to allow them to progress, particularly considering that many of them didn't have the opportunity to show their quality, their value, especially since it was, a year where they could be picked. The rules are the same for everyone. So whether it be a peewee category or senior category, it's the same rules that are going to be applied to everyone. So, and we're talking about, the draft and all that. It's the same situation for all sports. So hockey is not an exception. It's the same situation. So now with the epidemiological situation that we have right now, public health is allowing us to go back to training. And after, we'll be able to go back to games. But now, This is the first step, and it's training that we're talking about, so be able to train with your team members. Once again, as I was saying, we can have different challenges as well, I think that people, whether it be in hockey or regardless of the sport, have a lot of imagination and they're fully capable of motivating their players to resume training, to give them challenges and get them to really surpass themselves. Thank you. And you also spoke of training, intra-school training. Are there possibilities for young people to do that inter-school, to perhaps get closer to something that is similar to what they had before with games, if they stay in the same color zone? The first step is intra-school, and now it has to be understood that the pertinence of going in intra-school, if games are not allowed, it's not pertinent, to talk about inter-school. But intra-school, within the same school for the time being, and then we'll see the progression. Dr. Massé has something to clarify. Yes, you're quite right that it's not inter-school, not between schools, but right now it's intra-class. And in orange zones, we'll be able to do inter-class. So we'll go a lot more to what it was before, when there was a combination of students from different classrooms. So in orange zones, that will be authorized. If I might just add a point on the previous question, we really wanted for the reopening to be done, same thing in school as in organized sports or, in society at large. As well for sports, but also leisure, there's a lot of people who don't necessarily play hockey or baseball or soccer, but they do music, they do theater, they have other activities, and we also wanted for that to be open for people who do dance, who do yoga, who do all sorts of other activities. We found it really important that it be activities over a very large spectrum that could be opened and to not make exceptions, because it became very difficult to manage and also to justify. So a lot more equitable as approach for the public at large. Yes, very good point. Thank you.
On va passer à Olivier Bossé, Le Soleil.
Bonjour. La question était sur les
The question is for spectators, perhaps more, Monsieur Massé. If we can have spectators, in movie theaters, in show venues, why not in sports with distancing and masks? Well, we did have that in the fall until it created different issues. We'll eventually get there, but we're not ready for it now. So for now, it is without spectators. But I'm convinced that what you are proposing is something that will take place later. Thank you. Further question? Madam Minister, you mentioned yourself that you were stubborn. Were you hurt by the fact that people said that you were not involved enough in this? Well, my objective is to make it that people, whether they be young or not, be able to go back to their activities. It's not the kind of what the opposition, because it's mainly the opposition that emitted that comment. But there are people from the public who said it as well. I know the work that I've been doing. I know the work that I still have to do. The objective is not to get political capital on this. My objective is to make sure that our athletes can go back to their activities. So it is with that in mind that I've been working and that I've been in very close contact with public health. And it was not to make people happy who perhaps thought that I wasn't working enough. It's really to make it that, young people and others can go back to their physical activity as quickly as possible.
On va passer à Alexandre Pratt de La Presse.
Oui, bonjour, Madame Charest. Je voulais savoir tantôt.
Ms. Charest, I'd like to know, earlier on you talked about a pleasant summer and that sports were going to have to review certain protocols. Are you satisfied right now that with the protocols in baseball and soccer, where there was no outbreak, as far as I know, last summer, and do you trust that there will be games this summer for those two sports? Well, yes, we're satisfied with the protocols that have been set up by the different federations when we saw last summer that things went well. So I am confident that over the next few months, things will evolve very well. Of course, there's the entire notion of vaccination that is going to, that a part of the vulnerable clientele will be protected, and it'll be pretty much everyone who will be protected eventually. So I think that, in fact, there will be games relatively soon. And there you are. So I think that there's a good evolution, and Dr. Massé wishes to add something. Yes, not only are we very happy with the protocols and the organization around it, and it's one of the factors that allows us to be able to resume, but independently, we depend on people who are going to be doing activities of all sorts, sometimes with no protocols. Because there are many, a lot of people who do sports in the public in general, but are not necessarily in an organized structure. And so if we want to be able to maintain those activities and to continue opening, people absolutely have to be careful and must respect the guidelines. Because if people slacken off, and I'm talking about sports without protocols, that's where we had problems in the fall. That is where we had outbreaks. And that is what we want to avoid. So the protocols are good, and people, when they apply them, do well. But we want to make sure that everybody helps one another out to respect those guidelines, to avoid that these kinds of things happen. In many states, for example, the United States, it's possible to play hockey. The compromise that was found is that the young people have to wear masks during the games. But we can't right now in Quebec. What is the reason why public health does not recommend just wearing a mask and have a game? Well, right now it is not something that is recommended because we're not in a situation in order to be able to have games. So we don't have games. But when we go back to having games, of course, these are things that are going to be studied and that are going to be considered in as far as it's possible, because it might not necessarily be easily possible everywhere, but it is certainly not something that is excluded. When we were saying that we're going to have to redefine the way that we do things, of course, in a transitory period, perhaps there will be modifications that will have to intervene. But once again, once we're ready to have games, it's not now, but it should be within a few months, as I mentioned earlier. Those were all the questions in French. We'll now go to English questions.
Bonjour à vous deux. Andrew Brennan, CTV. Madame Charest, I wanted to go back and sort of touch on what you have said already, but expand. You talk about patience that a lot of particularly young athletes have had. What do you say to those? As we've mentioned, there's whether it's hockey or our high-level sports, or whether it's just those that are looking to do more, and you're still asking for patience. What do you say to them about what could happen in weeks to come? Right now, you're keeping the rules easy so that they're easy to follow. Everyone is on the same playing field, 8 people or 12 people. But for specific sports, whether it's people that are training, they want to go to the Olympics, and they're boxers, or whether it's someone who's playing hockey, like some of the young people we saw on the streets in Quebec last week. What do you say to them about they want to get back to playing? What do you tell them to sort of keep them staying patient?
Mm-hmm. Well, I think today is a very good news because we're reopening starting March 26th the organized sports. So for one thing, the athletes can be back with their colleagues and have some sort of a bigger environment to be motivated than to be practicing in higher level and to get active for the next steps. It's a first step, but it's it's a big first step, and it shows that we're going on the right path, and it's going to come pretty soon. And there's one example that I'd like to remind you of someone that because some people might think that because they were not active or they didn't have the same level of training, and they were they were not on the ice or they were not playing, that they would lose on the next events and stuff like that. And just remember about Laurent Dubreuil, who was just world champion a few weeks ago. He was on the ice for maybe like 20 times last year, which is probably like what he would be on the ice usually, like a regular year for 2 weeks. But that was within the entire year. So all the training that is done outside the ice and off ice and with his training partners and stuff like that has allowed him to be still, the best skater in the world. So I think the kind of training that the athletes are going to do for the next few weeks are going to get them ready. Of course, they want to be playing and they want to be competing, and that's somehow the goal of many of the athletes, but this first step is a good first step, and they're not going to be training for nothing. They're going to be training for being a better athlete for the next steps.
And I have a second question from a colleague, and I will tie it to something that we can talk about here. So, Dr. Massé, you already mentioned earlier about what you're thinking. We could be seeing a lot more people vaccinated, predominantly by June. How much faster do you think things will be going now that pharmacies are going to be involved? And just, I guess, going back to the both of you on this, does that mean that we, as you've been mentioning, that we could be seeing a second and third announcement about organized sports in weeks to come?
Well, we are going to have at least the 3 actual vaccines plus 1 or 2 others that will come this spring. So we are seeing we should have about 7 million doses of vaccine up to the end of June, which will permit us to vaccinate about 60, 70, 75, hopefully, of the population with the first dose, and then a part of them with the second dose. And that's a very significant. So is there going to be more vaccine coming in? It's possible, and some companies have said that they might be able to provide those vaccines. So yeah, that could increase the rate of immunization, and we'll manage and organize the clinics as fast as we can. And that will, in fact, permit the evolution in the activity that will come in. How fast that will come up, it's difficult to say. It takes us at least 2 weeks before seeing the change when you start from one situation to another one. So it's minimal 2 weeks between the stage, just to see the impact of what you've done and be sure that everything is okay. So just to be secure, it might be more than that between those steps. It could be between 2 and 4 weeks, but that's going to be looked at when it comes in. So those are the discussions that we have taken place. And I can assure you that we have had many discussions in the last few weeks, and we will continue to see how far we can go and reopen, so that in this summer we could have close to normal activities for the people that are expecting that.
Ça fait le tour pour les médias anglophones dans la salle. On va passer à ceux qui sont sur Zoom. Donc, Philippe Autier de Gazette.
Good afternoon.
Good afternoon.
Just a question for Dr. Massé. In French, you referred to a fragile balance in all of these measures. What are the risks of opening up these sports activities and facilities in red zones with the increased number of variant cases?
Well, we've seen, and you've noticed this last fall, that in certain instances we have had outbreaks related with especially sports groups, but different sports organizations. Most of it was really well done and well prepared, but we had those events, and those are large events that we have to be very careful. And with variants coming in the picture, we have to be very careful with that. So there's always a risk. But what we are seeing right now is that the rate has been decreasing for the last 8 weeks, and people have. In fact, restrained for those activities very significantly. I think all the measures that were put in place in January were really well received by the people, most of the people, I should say, and that has had an impact. So we are, in fact, dependent on the way that people will behave, and that's why we insist that people must respect the process. If people respect the recommendations, so we think that it's quite secure and it should go very well. But the fact that variants are present especially in the red zone, is something that we monitor every day. And something of concern for us. But as I said before in French, it's really a balance between the risk of keeping people close without sport activities or other activities, and mental health, and the fact that people will say, well, we won't respect those measures. So there's that fragile balance. So we think at this time we can reopen and see how it goes. And if it goes well, then we might reopen more in the next few weeks.
And my second question is for the minister.
Yep.
We saw there was a pretty big demonstration outside of the National Assembly last week. How much of this decision is political because the government was under a lot of pressure?
Actually, this is not a political decision. We've had so many discussions for the last year, and at every step of the way we were trying to find a way to make sure we can have access to sport and to physical activities. Of course, the discussion has intensified in the last few months. In the last few months and in the last few weeks. The public health is now feel confident that the situation is enough well managed that we can open more largely the sport facilities and the sport activities. So this is not a reaction to the demonstration. It's a reaction to the situation how it is now, and with all the work that's been done with the federations, with Sport Quebec, RSEQ, the AQLM, with everybody that is respecting the rules, and so now they feel confident enough to reopen the organized sports.
Alex Leduc, CBC.
Good afternoon. Do you hear me?
Yes.
Perfect. My first question is for the minister. It's expanding on some of the previous questions about looking forward. I know it's hard for you to put dates on future decisions, but I'm sure there's a lot of parents, a lot of young athletes out there who are wondering, when are my kids going to be able to play team sports in earnest? When are hockey players going to be able to play an actual game? Soccer players? I know it's hard to exactly give specifics, but are we talking weeks, months? And I'm talking if all the trend lines, the current trend lines with cases and vaccines and such, doesn't change from its current trends. What can you say to perhaps parents or young athletes who are thinking, when can I get back on the ice? When can I get back on the soccer field to play an actual game?
Well, actually, I think right now we have a very good opportunity to to have a different look on sports. When you say play hockey, I think practicing hockey is playing hockey. Of course, it's not a game, but it's the abilities and capacities you can develop by practicing are very well in an asset or a way of improving for an athlete. So I think we should focus on that now we can have kids practicing together, being on the ice or being on the soccer field and having a training session and making sure they're ready when this is going to come. Of course, we don't have a date, but the way the next few weeks are going to develop will have an impact on what's going to be next. So if we do play by the rules and respect the rules and prevent the spread of the virus, this could happen pretty fast. And with the evolution of vaccination and all that, so I think now we should focus on what we can do as kids or as not kids, as grown up in our sport activities. But there's so much you can do outside of having a game or an actual match that is beneficial for the athletes, and that's the message I think we should be saying to parents and kids. This is going to make you. It's not a game, but it's going to make you a better athlete for sure. Anyway, so. Yeah.
Thank you. My second question is for Dr. Massé. I was wondering if you could give us some more specifics on exactly what convinces you that the measures that are announced today are going to be safe. So I'm talking about perhaps if parents are worried about, well, should I be sending my kid back into sports, or perhaps more particularly, people thinking about going back to gyms, because that's something I'm sure a lot of people are thinking about. What specifically tells you that that is safe to do, these things are safe to do in red zones now?
Well, what we have done in the last year is to prepare specific protocols for team, but also for organization that will receive those people that are making sports activities. And we know that they have been respecting, most of the time they've been respecting them. So what we are asking is that, we come back to those protocols and that they will do it. We have had very positive reception and convincing offer by the organized sport that they will sign to those organizations, support them, support the protocols and implement them. But more than that, we ask the people that are responsible for sports platforms to supervise that the rules are well done. For example, for gyms, we will not only ask that people supervise how it's done, but also that people sign on when they are going to be using the gym, so that we know that who's been up there and using what. And for the organized activities in small groups, when we start, we are going to ask to have people to monitor how those groups are going to function. So there will be supervision. So we are very confident that all those people will behave and respect what's proposed. And if not, and if we have a report or outbreaks of people not doing things correctly, we might have to intervene. Obviously, this is not what we want to do. We don't want to go on that side of the fence. But if needed, obviously, it might be possible that some people that would not respect those rules, we would have to intervene, and we will do it.
Raquel Fletcher, Global News.
Good afternoon.
Good afternoon.
My first question is for the minister. You are obviously proceeding very prudently. You say you're reopening organized sports, allowing teams to train together, but not to have games. However, are you concerned that once you get a team of hockey players, for instance, out there on the ice where they're supposed to be training, that they won't be tempted to play a game? I can't imagine any greater temptation than a hockey player who hasn't been on the ice in so long now being allowed to go on the ice but not play. How are you going to ensure that, spontaneous games don't start up?
Well, I think we need to have faith and confidence in the people responsible for the organization of the sport. Of course, as we mentioned a few times, the situation is still very critical. So today we allow the organized sports and leisures to reopen by. And this is conditional to the fact that they're gonna comply to the rules. So I'm confident that the people responsible or in charge of making sure these rules are respected are gonna do so. And of course, like Dr. Massé mentioned. If there's a spread of the virus, well, nobody's a winner in that situation. If we need to close to lock down the sports, nobody will benefit for that. So I think we have confidence that the people in charge of making sure the rules are respected are going to do so, and the participants are going to do so as well. So that's why we need the participation and the collaboration of everyone to make sure that this goes well. And if it goes well, we're going to be able to progress to bigger openings. Thank you.
In terms of gyms that will now be allowed to open, gym owners have been saying for a while that they, were going to, or were very open to putting in whatever measures were necessary to make those gyms safe. They even threatened to open the gyms against public health guidelines. Why now have you decided that it is safe for these gyms to open in red zones?
Well, as you said, we are confident that people can respect the line or the recommendation that's been put forward. In fact, we did cut not only gyms, but a lot of other activities that we had to lock down just to prevent the spread of infection. And we think that right now, gyms, like other sports, we are opening. So we are not making a specific difference for gyms as for the other ones. We are opening all of them. And we think that they are able to, in fact, manage things correctly. There are special things for the gyms, as we said before, that there's going to be mandatory registration and keeping the information, a bit as what we have been doing in restaurants, so that if there's anything that would happen in the gyms, then we would be able to come back and see who has been in contact. There had been outbreaks in the gyms last fall. Most of them were well controlled, but at the same time, we want to be sure that we have all the means to be able to intervene if needed. But we are very confident, as the gym owners have said, that things are going to go correctly and people will respect all the measures that have been asked.
On a terminé avec les médias en anglais. On a un média en français qui a levé sa main.
So we have one more French question.
Oui, bonjour à vous deux.
Hello to you both. I would like to know what explains the fact that in the United States, in most states, they don't have that discussion. Competition is allowed right now, even in contact sports. Well, it's interesting that you are raising the issue in the U.S. because there's been a lot of transmission, and the infection rates, the contamination rates, even in organized sports, have been very high, very significant, even when there were tests that were being asked for regularly. So I think that we have to be very careful when we compare things. We believe that the control measures that have been set up here, first of all, were efficient, and we've seen it very well since January, and we saw it last summer as well, to control things. And we think that reopening all activities all at once is a risk that would be significant, and that is why we're going slowly. I think that everybody can understand the prudence, the difficult balance that I was referring to earlier on. So for us, the example is what has been going on in the United States. We are looking at it, we read about it, we follow it every day, but we do believe that we have to go very prudently. And the introduction of the variants, not only in Quebec and in Canada, but throughout the world, brings us to be prudent. Where even if people propose sometimes having tests don't prevent cases. And if testing gives people a false feeling of safety and they stop following the other measures of precautions that everybody knows now, well, that ends up putting us in a situation that isn't any better. So I really consider that the approach that is that of not only Quebec, but in Canada in general, as well as in Europe, is an approach that is safe and that allows us to reintroduce things. So I do not think that for the time being, the example of the U.S. is one that we should follow. As a follow-up, I know that you don't necessarily want to give a date, but could we say or mention that the 1st of September is a date that's crucial? Back to school, the next fall session of sports students, is that the date that you're choosing for the return to competition? I can't say. I really can't. You are projecting us much too far ahead. The situation is evolving and changing from week to week. We can't predict what will happen by then. Of course, with the evolution of the vaccination process, I think that, in fact, I dare hope that it will even happen before then, but I couldn't give you any date. But for sure, as soon as we can remove the lockdown at a broader scale, we will do so. And there you are. That's pretty much all I can say in my predictions. Thank you, everyone. The press conference is now at an end.